On this note, I'd like to call on Dr. Jude Marie Banatte, the Regional Director for Central Africa, to give the keynote address on behalf of CRS. Welcome.
Honorable Minister, representative of the Diplomatic Corps, member of the Parliament, chief and directors, fellow advocate for global progress, distinguished guests, ladies and gentlemen. Like me, many of you, as you just saw it, may have experienced problem or frustration lately because of the undersea cable failure. We all have suffered. And our lives are so intricately woven into the fabric of technology and connectivity today. So this outage highlights the fragility of our interconnected infrastructures and underscores how vulnerable we are when technology falters. My voice couldn't get through the room simply because we didn't have the right technology. It serves as a stark reminder that technology, while empowering, is delicate. Today, I stand before you to discuss a topic that bridges the realms of technology, for sure, compassion, and empowerment. Over the past decades, technology has undergone remarkable transformation. I remember when I joined CRS some 25 years ago, the way we lived, the way we worked, the way we implemented our programs looked quite different from what we do today. I remember I used to share a desktop with a fellow colleague, so we had to take turn and we had time and schedule to use that machine. Cellular communication at that time was a luxury. Smartphones, tablets didn't even exist. Google was probably at its beginning. Internet itself was very limited to a few. Interactions with partners, program participants had to be 100% in person. We had to travel or we had to have them travel so we could meet at one point. Let's think about programming, evaluation, assessments. We had to take over field data collection phase, then bring all the papers back to the office, data entry phase, and then analysis, and then reporting and probably publications. We're talking about 2-3 months down the line. So at the beginning of ICT4D, ICT4D was primarily focused on information system. Researchers explored how emerging technology could enhance communication, data management, and decision-making in development projects. The arrival of internet and mobile phones marked the beginning of a digital revolution. The proliferation of mobile networks and alternative energy sources expanded the ICT4D reach. Mobile phone became ubiquitous, connecting even the most remote communities. Innovation like SMS-based services, mobile banking, and telemedicine emerged, empowering individuals and organizations to address pressing needs. Today, ICT4D is deeply embedded in development work. It transcends discipline and involves technologies, policymakers, and practitioners. Because of the advancement, our work looks very different today. We routinely capture data digitally. We leverage data analytics and visualization for adaptive management. We engage with program participants using digital means. The digital transformation is, in our programming is not an if today. It's more of a how. And most importantly, this isn't about us. It's about how we can support our partners, from national government to community-based organizations, to benefit from digital transformation. Equipping local government and organizations is pivotal for achieving better outcomes in critical areas such as agriculture, health, emergency response, and more. Imagine a world where health campaigns are transparent, efficient, and data-driven. For the last decade, Catholic Relief Services digitized a mass health campaign across West Africa and Central Africa. Initially, this involved us selecting our appropriate digital solution, rolling out its use, and inviting national partners to access our platforms. I'll be honest with you, exactly how the digital systems was going to be handed over to government and to the partners, indeed, whether and how that would fit into the complex national health system was not a priority at that time. Today, as we lead implementation of digital campaign in over a dozen countries, delivering millions of bed nets annually, our approach is quite different. We start with understanding the local context and what national systems are in place. And not just the technologies, the people, the processes behind them, and then we co-create digitization efforts with our partners. By leveraging technology, CRS ensures real-time insights into frontline staff activities, optimizes distribution processes, and then identify underserved communities. In Nigeria alone, for example, over 65.5 million of bed nets have been distributed using digital means. CRS's ambition is to catalyze transformational change at scale. To achieve this, we must engage in regular reflection on how we work and engage with systems in a deeply contextualized manner. The shift in our digital approach to malaria programming is a good example of this. It also behooves us to remain up to speed on new technological development, as this seems to happen almost on a daily basis now. AI, generative AI, is of course the latest trend in terms of emerging technologies, and the sheer number of sessions focusing on AI at this conference is a testament to how we, as a sector, are seeking to leverage this new capability. It's also a sign of how we are taking our pledge to do no harm seriously. As a sector, we are still learning what the opportunities and the pitfalls are. After all, as in any work we do no harm needs to be our guiding principle. And the examples of where generative AI has contributed to reproducing stereotypes and strengthening existing power imbalances are far too frequent to ignore them. Speaking of generative AI, we also need to recognize that not all have equal access to these potentially powerful tools. With AI, as with other powerful technologies, concern remain that these will contribute to deepening the digital divide, where larger, like international NGOs, can afford access while others, like local partners, cannot. This is also why I am pleased that there are several sessions at this conference discussing the opportunity digital public goods offer. With all the focus on the opportunities digital brings, it's easy to forget that more than 2.6 billion of people remain unconnected, then in digital blackout, according to the International Telecommunication Union. While access to technology does continue to grow, large gaps remain between high and low income countries. And even within countries, gender, age, location continue to impact internet use among populations. In low-income countries, less than 1 in 5 people living in rural areas use internet. It's also worth noting that connectivity is not equal. There's a huge difference between someone using occasionally a 2G internet for some chat versus someone brandishing the most recent iPhone with steady connection and with high speed and stable connection. So we also see the dynamic internally even between our offices, when there are disparities in connectivity and ability to use various digital tools depending on location. Again, when it comes to talk about partner, the issue is even compounded. Let's be clear today. There's a cost of being on the wrong side of the digital divide, both for individuals and organizations. Limited connectivity, poor digital skills, and lack of digital literacy contributes to further marginalizing the already marginalized, limiting their opportunities even more. It also exposes digital individual to risks in terms of privacy and security, as well as being the victims of dis, or malinformation. The same goes for organizations. Lack of investment in local organization, digital systems, and skill also present a barrier to the broader localization agenda. And yet, I firmly believe that digital technology plays a key role in addressing the wicked problem of our time, from climate change to healthcare access, food security, and youth unemployment. And this conference is a testament to that. In summary, technology empowers local actors, enhances resilience, and fosters sustainable development. Let us champion its integration, ensuring that no community is left behind in our pursuit of a healthier, safer, and more prosperous world. Let us commit to the vision of a world where the most marginalized and the remote people benefit from technology. Let's raise awareness about ICT4D's potential and encourage policymakers to invest in digital infrastructure. Let's focus on supporting partners' digital transformation and continue to advance universal and meaningful connectivity. Let us work tirelessly towards a future where every person, regardless of their circumstances, can access the transformative powers of technology. May our collective effort pave the way to a more equitable and connected world. Thank you.